Hello and thank you for watching. This is group number three's project for our Global or National Health Challenge assignment in our Intro to Healthcare Systems HSA 6103 class. In this project, we have Claire, Abraham, Misty, Alicea, and Lance Potvin.
Bringing awareness of mental health to gain empathy and sympathy from the whole community. Are you aware that 1 in 5 Americans suffer from mental health illness? According to Mental Health America, if we were to scale a few common statistics to our class size of 21 students, you'd find this. 12 of us will be diagnosed with a mental illness or disorder sometime in our life. 4 of us are currently suffering from some sort of mental health issue, and 1 of us will experience some sort of serious mental illness this year. Furthermore, of the 50% of us that are diagnosed with a mental illness or disorder, more than half of us will go untreated. Thank you for viewing this brief presentation. My name is Lance Potvin, and I'll be presenting with Claire Abraham and Misty Alicea. We come from 3 very diverse professional backgrounds, but we're here to talk about one very common national health issue, that it's okay not to be okay. I will be discussing what is mental health. Claire will continue on to discuss mental health in Florida, our own backyard. And Misty will conclude our presentation with ways to fight the mental health. So what is mental health? According to the Centers for Disease Control and Prevention, mental health refers to an individual's emotional, psychological, and social well-being. It's about how a person thinks and feels and acts. Your mental health can impact how you deal with stress, how easily you relate to others, and the choices that you make on a day-to-day basis. Dr. Tim Sharp of the Happiness Institute explains, good mental health will look different in different people, but as a general rule, good mental health includes high levels of positive emotions like happiness and joy, satisfaction and confidence, and low levels of negative emotions like depression and anxiety. Tim goes on to say, good mental health would almost always also include the presence of good physical health, positive relationships, and meaningful work. In other words, mental health is a concept similar to physical health. It refers to a state of well-being and includes our emotions, relationships, thoughts, and feelings, and the ability to manage life's highs and lows. Mental illness, on the other hand, refers to a wide range of mental health conditions, disorders that affect your mood, thinking, and behavior. Although the terms are often used interchangeably, poor mental health and mental illness are not always the same. A person can be experiencing poor mental health and not be diagnosed with mental illness. Likewise, a person can be diagnosed with a mental illness and experience periods of physical, mental, and social well-being. Some examples of common mental conditions include anxiety disorders such as panic, phobia, and obsessive-compulsive disorder, or OCD, behavioral disorders like ADHD and conduct disorder, eating disorders such as anorexia, bulimia, binge eating, substance use disorders, mood disorders including depression, bipolar disorder, or self-harm, personality disorders, psychotic disorders like schizophrenia, suicidal behaviors, trauma, and stress-related disorders. And unfortunately, many of these conditions often carry with them a stigma. According to the Mayo Clinic, a stigma is when somebody views you in a negative way because you have a distinguishing characteristic or personal trait that's thought to be or actually is a disadvantage. This is another way of saying a negative view or a stereotype, and negative attitudes and beliefs towards people who have mental health conditions are very common, and a stigma can often lead to discrimination. Types of mental health discrimination can be public, self, or institutional. Public stigma involves the negative or discriminatory attitudes that others have about mental illnesses. The stereotype here is that people with mental illnesses are dangerous, incompetent, and to blame for their disorder and unpredictable. The public discrimination then manifests as employers not hiring those with mental health illnesses, or landlords not renting to them, or healthcare systems offering a lower standard of care. Self-stigma refers to the negative attitudes, including internalized shame that people with mental illness have about their own condition. An example of this might be the internal feeling of being dangerous or incompetent or to blame. Self-discrimination of this stigma leads to thoughts that lower self-esteem and self-efficacy. Institutional stigma is more systematic, involving policies of governments and private organizations that intentionally or unintentionally limit opportunities for people with mental illnesses. Examples include lower funding for mental illness research or fewer mental health services relative to other healthcare institutions. Institutional prejudice are embodied in laws and regulations. And because of these stigmas, and how we know that these stigmas exist, 8 in 10 workers say shame and the stigma prevent them from seeking treatment from a medical health condition, according to the National Alliance on Mental Illness. 56% of adults with mental illness do not and will not receive treatment. 11% of adults with mental illness are uninsured. People with severe mental illness are over 10 times more likely to be victims of violent crime than the general population. Now, Claire will walk us through mental health in our own backyard, the state of Florida.
Thank you, Lance. Most stigma research is conducted in the assumption that stigma operates similarly for everyone. But mental illness stigma varies across cultures and communities. Culture-specific beliefs, values, historical injustices, and mistreatment by the healthcare system and government impact mental health stigma. Let's deep dive into the different communities that we have here in South Florida. First, let's talk about the African and Caribbean communities' beliefs and realities. They value spiritualism. Some view mental illness as a lesson from God about patience or a test of faith, or as a punishment because of the affected person's sin. Therefore, most of them will turn to a religious and non-mental health professionals like a voodoo priest for help. Then, they have limited experience with mental health treatment. They will describe mental health illness as an upset stomach or aches and pains throughout their body. Next, we have racism. Study shows that cumulative effect of racism can cause chronic stress and lead to depression, anxiety, and PTSD symptoms. Then we have adverse childhood experiences. 62% of Black adults have experienced some form of ACE, which increase the risk of developing mental health disorders. Over 3 times as many seriously mentally ill persons are incarcerated other than being in the hospital, and nearly half of prisoners in the US are African American. Last but not least, no faith in the healthcare system. 1 out of 3 African Americans stated that they received the wrong diagnosis because of the color of their skin. Then we have the Asian American community. In the Asian culture, the mind and body are seen as inseparable. For this reason, they may express psychological symptoms somatically and will seek help for any emotional problem from a traditional healer as opposed to a psychologist. They also believe that mental illness is a punishment from God, caused by a supernatural influence, the results of bad deeds in a previous life, or indicative of bad genes. Given the collectivist nature of many Asian cultures, having a mental illness is a reflection on the person's family, and emotional self-control is valued and the norm. And for Middle Eastern communities, concealing emotion is valued. Therefore, seeking mental health treatment could be problematic. Next, we have family honor. They must behave in a way that reflect well on others at all times. They also believe mental illness is due to possession by evil spirits, sorcery, evil eye, or weakness in faith. Then, post-traumatic stress disorder and depression are the most common mental disorder in the aftermath of war for adults and children from this community. In the Latino community, Marianismo means that women should endure suffering with dignity, be moral, nurturing, and self-sacrificing. In contrast, Machismo means that men should be firm, provide, protect, and defend their families. And if you don't, you will be seen as weak and useless. They also value personalismo, which refers to valuing and building interpersonal relationships. Those with mental illness may isolate themselves from others and act in a way that damage their interpersonal relationships. Then we have the LGBTQIA community. 1 out of 5 LGBTQIA states that they never had a good experience in healthcare, often face discrimination and stigma when accessing healthcare. Studies have shown that this negative experience can cause people to avoid getting essential mental help. Discrimination, prejudice, denial of civil and human rights, harassment, and family rejections are still common for people who identify as LGBTQIA. And because of lack of federal employment non-discrimination protections for LGBTQIA individuals, transgender individuals experience higher rates of poverty and unemployment than non-transgender individuals. Then, LGBTQIA individuals are more likely to be victims of violence than their heterosexual peers. And it is also important to mention that we also live in a society where even being a woman or men can create self-stigma. If you're a woman, you are emotional, you should behave, you should bear children, and you should be thin and beautiful. And if you are a man, you're not supposed to cry. You should support and protect the family. You should be in control. You should be good in sport. Research has shown that being a part of a marginalized group in and in of itself, it's a source of stress. Witnessing violence towards individuals from one community can cause serious trauma and even symptoms associated with post-traumatic stress disorder. People from marginalized communities are not only more likely to experience mental health issues due to social determinants and institutionalized racism, but they are also less likely to have access to treatment for their concern. That being said, being from wealth and privilege does not prevent you from mental illness issue. Based on research, 34.7% of white people face depression, which is higher than Hispanic at 19.6% and Black at 24.6%. So, how do we make a change? Misty will take it away from here and discuss the available resources.
Thank you, Claire. The statistics and the facts that Claire and Lance have just touched on are quite scary, and they hit a little too close to home, don't they? Unfortunately, in America, mental illness is stigmatized more than any other illness or condition. It's okay to go to a doctor when you have a broken bone or you need stitches. In fact, you might even display those scars proudly. Yet with mental health, we tend to be ashamed. But good news, there is light at the end of the tunnel, and I'm going to talk about how we together can fight the stigma and break the cycle. The first thing we can do to break this cycle is educate ourselves. Educate ourselves and those people around us. Check your preconceived notions and fact check some of the common myths. For example, number 1, mental illness isn't a real illness. Wrong. Mental illness is an actual illness with effective, evidence-based treatment. Number 2, people with mental illness are dangerous. Wrong. Mental illness is not a predictor of violence. However, people with mental illness issues are more likely to be victims of violence as opposed to being violent themselves. And number 3, mental illness is a sign of weakness. Wrong. This is no more true than saying a broken bone is a sign of weakness. In fact, I'd say that if you have the courage to admit that you have an issue and seek out help, you're stronger than most of us. According to the World Health Organization, depression alone is a leading cause of disability worldwide and costs nearly $200 billion in lost wages every year. Let me say that again, $200 billion. Unfortunately, these numbers only continue to grow. Also growing are the suicide rates amongst adults, children, and adolescents, and even celebrities like Robin Williams, Naomi Judd, Kurt Cobain, Ernest Hemingway, Kate Spade, and Vern Troyer, aka Mini-Me. We need to normalize mental illness, and we can only do this by talking about it openly. And while we are talking, please remember our words matter, and we must be conscious of them. Her presentation was nuts. Oh my God, that was crazy. That movie was retarded. All of these statements cause intense pain, and they add stigma of mental health. Challenge yourself to find other ways to express yourself. Find new adjectives to describe how you feel. It may be difficult at first, but I believe in you. While continuing this often uncomfortable conversation, I have another exercise for you to do. And yes, this one is also a little bit difficult at first. But when talking about ourselves and others, remember we are not our diagnosis. She is anorexic. No, she has anorexia. He is bipolar. No, he has bipolar disorder. They are drug addicts. No, they have substance use disorder or they have an addiction. He is brain damaged. No, he has a brain injury. I am OCD. Instead, say, I really like things to be organized. Be an ally. Do not be shy about correcting your friends and strangers when they slip. Challenge society's misconceptions and stereotypes. This advocacy will change people's misunderstandings, and when you hear someone struggling, remind them you are here for them. Offer a hug, a shoulder to cry on, or an ear to pull. Let them know they are not alone. Share your own personal struggles and your stories. Talk openly about self-advocacy. This is extremely important. We often brag about going to the gym to tune up our bodies, but what if we started bragging about going to therapy to tune up our minds, learning about ourselves, loving ourselves, accepting ourselves? What if we are all open about it and normalize it? Then maybe others will be more apt to consider going to therapy themselves. We can also be an ally when we are talking about pop culture and celebrities. Without judgment, we can praise them for having the courage and being brave enough to disclose that they too battle with mental health issues. You'll be surprised at how many successful people in our society have or continue to battle mental illness. Chrissy Teigen, Adele, and Kylie Jenner have all talked openly about their postpartum depression. Demi Lovato, Kanye West, and Mariah Carey have been public about having bipolar disorder. Donny Osmond, Zayn Malik, and Taylor Swift, social anxiety disorder. Michael Phelps, Justin Bieber, and Will Smith, ADHD. Leonardo DiCaprio, Howie Mandel, and Daniel Radcliffe, OCD. Lady Gaga, Ariana Grande, and Oprah Winfrey, PTSD. Beyonce Knowles, Ryan Reynolds, and Camila Cabello, anxiety. Dakota Johnson, Emma Stone, and Kendall Jenner, panic attacks. Dwayne Johnson, The Rock, Ellen DeGeneres, and Megan Thee Stallion all talk about struggles with crippling depression. And the one I want you really to pay attention to is Lil Wayne, Owen Wilson, Nicki Minaj, Halle Berry, and Zachary Levi have talked about their struggles with suicide ideation and surviving the attempts to take their own life into their hands. But why? Why me? Why my friends? And why my neighbors? But better question, how? How does this happen to us? The brain is cool, it's beautiful, it's intricate, and it's very complicated. Modern science has still only just begun to understand how it works, let alone understanding what happens when there are issues with the brain functioning. There are many, many factors that can contribute to the onset of mental illness. Biology and genetics. Physical illness is not the only illness we inherit from our bloodline. Our environment. Many of the celebrities on the last list openly talk about the pressures and anxiety for their performances, leading to panic attacks, for example. Don't forget about the effects of stress and trauma. And lastly, social dynamics. Imagine being a member of a marginalized community and the world around you tells you that you are worthless and you don't matter because your skin is black or because you're transgender or gay. Unfortunately, one of the stigmas affecting us on a much larger scale is the way our insurance companies cover, or more specifically, do not cover mental health care or psychiatric interventions. So, when you finally do decide to invest in yourself, can you even afford it? Here's the thing, mental health care works, and those who do seek treatment for mental illness have great outcomes. For every dollar that's invested in treating depression or anxiety, for example, you can see a yield of $4 in healthcare outcomes and ability to work. With those numbers, I think it's worth investing in yourself. But locally here in South Florida, we have organizations that will help you without insurance or even the ability to pay, like SunServe, MHA or Mental Health Care America, FISP, Florida Initiative for Suicide Prevention, and Henderson Behavioral Health. Please feel free to take a screen grab of this presentation for future reference. Also note that nationally, the suicide hotline phone number has changed to 988. Please understand that judgment is a natural part of our human condition. However, when that judgment escalates to discrimination, prejudice, or worse, hostility, it becomes a breeding ground for stigma. And, as Lance stated, stigma is defined as a mark of disgrace as a result of stereotypes and misunderstandings. Imagine if we as a community, as a society, or even as individuals can start to see people with mental illness as just people, no different from you or I. My hope is that one day we as society will believe and know it's okay not to be okay. Thank you for watching, and we look forward to your questions and comments in the discussion. Thank you.
Here is a list of all of our resources used in this project. Not sure how to do resources in a PowerPoint, but this is APA format as if it were a paper. Thank you so much for watching this far. Please take it upon yourself to help reduce stigma about mental health. Invest in yourself. Believe in yourself. And again, thank you for watching.